So the school started back in 1970. And if you think about what was happening both in the nation and then also here in Chicago, there were a group of faculty and members of the Illinois legislature who were particularly interested in sort of moving Chicago, the state, and the nation forward in terms of public health issues and activism. And that really was a lot of the start of the School of Public Health.
So I envision the school's legacy going forward are going to be its contributions to improving public health through our research and our advocacy and contribution to policy and implementation, and through our training of our students so that they are aware of public health and the issues that are facing the public today and how to best tackle those in an effective way.
I've been here for 33 of those 50 years. And to me, after all these years, we now have established ourselves. We have a strong alumni base. And what are our alums doing? They're the leaders in the community.
The greatest legacy are the students. We have 5,000 alums now. So there's a tremendous legacy and people working in Illinois and the Midwest, but throughout the world.
I think there are several things that we want to think about as we move the school for the next 50 years and beyond. We need to be thinking about and focused on making sure our students are well equipped to meet the challenges both of today and of the future. Number two, making sure our research is cutting edge. And we need to be nimble. And I think if we're able to do that effectively, we will continue to be one of the top schools of public health in the nation.
I'd like to think that we're a school that really makes a difference in the communities that we serve. And once again, that extends from local to global. That special sense of mission, that special sense of a public institution having a responsibility, a mandate to take what it's doing as an academic institution and change it into real-world change or impact is what is important about this school.
I think what's kept me here for 33 years is the fact that I really respect my colleagues. And I think that leads to a very rich learning community here.
I really think that the unique niche that the University of Illinois Chicago School of Public Health can fill is one of really training high-quality public health practitioners who can really make a difference in the field.
When I think about a moral imperative for this work, I think about what needs to be done to ensure that every young child and young person growing up here on the near west side of Chicago has just as much opportunity for their lives and their careers as a young child living anywhere else in our city.
There's not a better group of future public health leaders that we have that are going to be able to challenge and overcome many of those challenges that public health will face.